Gentlemen, let me start by asking you a simple question. When was the last time you paid calm, intentional attention to your penis that wasn't rushed, anxious, or performance driven? Not during sex, not during masturbation, just quiet care. I know that sounds unusual. Some of you may already be thinking, Doctor, this sounds like one of those internet gimmicks. And that's fair. There's a lot of nonsense out there. But stay with me for a moment, because what I'm about to explain isn't magic, it isn't mystical, and it isn't new. It's simple biology, paired with something men were never taught to do as they age. Once you understand the logic, this will make sense. My name is Dr. Lina. I'm a medical doctor, board certified, and for many years now, I've worked closely with men over the age of 45. I see men every single week who are successful, intelligent, disciplined in many areas of life, yet quietly worried about changes they don't feel comfortable talking about. Erections that don't feel the same, sensation that feels muted, confidence that has slowly slipped, not because desire is gone, but because the body isn't responding the way it used to. And what I want you to know is that this topic is rarely discussed openly, even in medical offices. Not because it isn't important, but because men have been conditioned to think they should just accept it or fix it with a pill. Here's the reality of aging that no one explains clearly. Starting in your 30s, and more noticeably in your 40s and 50s, a few quiet shifts begin to happen. Testosterone doesn't fall off a cliff, but it does gradually decline. Blood vessels lose some elasticity. The pelvic muscles, which are deeply tied to erections, often become tight rather than strong. The prostate can become more sensitive. Sleep becomes lighter, more fragmented, and the nervous system spends more time in a guarded, stressed state. None of this means you're broken. None of this means it's all in your head. It means your body is adapting to time, and adaptation requires support. One of the biggest misunderstandings I see is the belief that male performance is only about hormones. Hormones matter, yes, but erections are not powered by testosterone alone. They depend on three core factors working together: blood flow that can move easily into the tissue and stay there, muscle tone that is responsive, not clenched or fatigued, and nerve signaling that is calm enough to allow arousal rather than shutting it down. What's important, and often overlooked, is that all three of these factors remain modifiable at any age. The body does not stop responding to care just because you crossed a birthday. This is where a very old, very simple technique comes in. Penile oiling is not about stimulation. It's not about chasing an erection. It's about improving tissue health, circulation, and relaxation at a time when your body is most receptive to repair: nighttime. When you sleep, your nervous system downshifts, growth hormone rises, tissue repair increases, blood flow patterns change. Using gentle touch and a supportive oil during this window works with biology, not against it. The reason the material matters is because dry skin, friction, and rushed handling all send the wrong signals to aging tissue. A simple, clean oil creates glide, warmth, and sustained contact. Traditionally, various cultures used oils for male vitality, not because they believed in magic, but because oils reduced inflammation, support skin integrity, and allow deeper relaxation of underlying tissue. Modern biology supports this. The skin of the penis is highly absorptive. Gentle massage increases local circulation. Warmth signals safety to the nervous system, and reduced tension allows blood vessels to open more fully over time. Let me explain how this is done in a way that feels respectful and grounded. This is not a clinical procedure. It's a quiet, private routine. At night, after washing your hands and ensuring cleanliness, you apply a small amount of oil to your palms and warm it between your hands. You're not rushing. You're not gripping. You gently apply it along the shaft, the base, and the surrounding pelvic area, because erections do not begin at the tip, they begin at the root. Pressure is light to moderate, never aggressive. The intention is warmth and relaxation, not stimulation. The entire process takes less than 5 minutes. When done correctly, it should feel calming, not arousing. Nighttime matters for a reason. During sleep, the body naturally produces nocturnal erections. These are not about sex. They are about oxygenating tissue and maintaining health. Supporting this process gently a few nights per week helps reinforce what the body is already trying to do. You don't need to do this every single night. 3 to 5 times a week is realistic. Consistency matters far more than intensity. This is not something you force, it's something you allow. What men tend to notice first is subtle, a sense of warmth, less tightness, better sleep. Some men report fewer awakenings at night. Over time, morning erections may feel more reliable, not necessarily stronger overnight, but more present. Confidence begins to shift quietly, and that's an important point. These changes are signs of restoration, not stimulation. You are supporting health, not chasing performance. There are secondary benefits that often surprise men. Reduced pelvic tension can ease pressure on the prostate. Urinary flow may feel smoother. Some men notice fewer nighttime bathroom trips. Lower back or hip tension can decrease because the pelvic floor is deeply connected to those areas. Even posture and emotional confidence can shift, because when the body feels supported, the mind follows. I want to be very clear about safety. This is a supportive habit, not a replacement for medical care. If you have active infections, open skin conditions, or significant pain, this is not appropriate. If you've had recent surgery or are under treatment for a serious condition, talk to your doctor first. Hygiene matters, awareness matters, and expectations matter. This is not an instant fix. It is a gradual, cumulative support. The easiest way to make this work is to anchor it to something you already do at night, after a shower, before brushing your teeth, before bed. Make it automatic, not a decision you debate. Some men choose to involve a partner, not as a sexual act, but as a shared relaxation ritual. That's optional. The key is that this is about care, not performance. I want to leave you with this reframe. Aging does not mean decline, it means the rules change. Small, intelligent habits practiced consistently can produce meaningful long-term results. I encourage you to think of this as a 30-day personal experiment. No pressure, no expectations, just attention and consistency. Your body is not failing you, it's asking for a different kind of support. And when you provide that support calmly and respectfully, you may be surprised by how much responsiveness is still there. Take care of your circulation, take care of your nervous system, and remember, confidence is not something you force, it's something that returns when the body feels safe enough to respond.